Hello, hello. Let's welcome and open up the doors. So hello, everybody who has joined us live here in our Zoom room at dailywithdoczoom.com. And hello to those who are watching our live streams out there in YouTube land and Rumble land and Facebook. Hello and welcome, welcome, welcome. My name is Becca Dukes. I am the hostess of this program, and I am honored, humbly honored, to be part of this crusade where we are bringing Dr. Joel Wallach to you Monday through Friday, almost every day. We have a few days that we have to take off because of other presentations that are live in person, off-site, and away from the office where we don't always have good connections. So we don't want to schedule something and then have you all show up and then we can't get on because we don't have internet at the remote locations that Dr. Wallach and I will be going to. So Dr. Wallach, I'm super excited to get you back on the road. Are you excited?
I'm always excited.
Well, that doesn't sound excited at all.
Well, yeah.
Is that excited?
Yeah, very.
Okay, well, folks, we are getting back out and getting out there and being able to help people where they're at, because not everybody has internet, not everybody knows how to get on Zoom, or for us right here, it's a little more difficult when somebody wants to call in and ask questions, because unless I know that they have a question, I don't know to ask them to unmute or to allow them to unmute. So I'm excited that we're going to be doing this, Dr. Wallach, in more formats than just on YouTube. But I am very proud of all of our watchers and listeners, Dr. Wallach, because I see when people share our program. And for those of you that are sharing, kudos, good job. That's what we're here for. We're here to spread a message of hope, a message that allows us as individuals to not be slaves to chemicals. Because what's the difference between being dependent on a prescribed narcotic to to an illegal narcotic, Dr. Wallach?
Well, the only difference
is there a difference?
Yeah, the only difference is a doctor writes a prescription for one, he takes home some money so he can put his kids through college.
Well, that kind of leads into what I want to talk about today, Dr. Wallach, because I know through all of your research, and folks, if you don't know Dr. Wallach has a degree in agriculture. He has a doctorate in veterinary medicine. He has 3 postdoctorates in pathology, and that's all before becoming a naturopathic physician. And I know in some of your research, Dr. Wallach, you were looking at kidneys, and you weren't finding anything wrong with the kidneys. Yet, whenever they say kidney failure, and I know some of the cases that you worked on, it was said kidney failure, but when you look at the kidneys, what would have caused them to fail?
Well, the kidneys are a series of tubes and blood vessels and this, that, and the other, and it has several functions. The kidneys make urine. So it takes, the toxic stuff out of the blood, puts it into urine, and you have urination 3, 4, 5 times in 24 hours. And that's getting rid of the stuff. Now, also, the kidneys produce substances that make your blood pressure go up. Why do you want your blood pressure to go up? Because it wants more blood going through itself so it can filter it. And if it's not getting the blood at once, it sends out those chemicals to make the blood pressure go up. So when their blood pressure goes up, that tells you right away, most of the time, is because your kidneys are having a struggle doing their job. And so they're trying to do their job by getting the blood pressure to go up to force more blood into the kidneys. And of course, then I get people that haven't urinated in 10 years. They haven't urinated in 10 years, okay? Because their kidneys are so damaged. They're on dialysis 6 days a week. And this is the sort of people that I get. The doctors throw up their hands and say, well, we can try a kidney transplant, but we haven't found anybody who's willing to give us one of their kidneys. We haven't, had somebody who was in a car accident and died within, reasonable driving distance here that had the same blood type and everything like that. And so we haven't really been able to get, most of these people with kidney issues a transplant. And so that's kind of where the medical system is for kidneys. Well, really, I work on getting the kidneys working again, and we can talk about that in a minute, so that the blood pressure comes down very quickly, because once it's working, it doesn't need to have high blood pressure, because the high blood pressure was done by the kidney to force more blood into the kidney. Okay, so we are able to drop the blood pressure into the normal ranges, get them off of dialysis, and they're happy as possible. Okay, we do this literally hundreds of times a month all over the world. And we're here coming up here pretty soon. We're looking at 50 more countries joining us. We're so excited about this. And then in another couple of months after that, another 20 will join us. That's into the 80 we have right now. So we're getting up there to where like 2/3 of the nation's being represented with longevity. And kidneys, every vertebrate, including human beings, have kidneys. We got to take care of them. It's not hard, okay? It's not difficult, but it's something you have to be aware of what you need to do. Everybody, well, I think about my heart, I have to think about my lungs, I got to take care of my liver. But very few people think, what am I going to do to take care of my kidneys? And that's because doctors don't know. And so they're not in a position to give advice to the patient.
So I want to point something out, Dr. Wallach, something that you said that people don't correlate, okay? Because I have seen so many people with high blood pressure and kidney problems.
Mm-hmm.
The high blood pressure is coming because of the kidney problems. Am I understanding this right?
Right. Well, the kidney makes the blood pressure go up, trying to drive more blood into itself.
Okay, so would that be a circulation issue? Would that be dirty blood? Would that be contamination? What would be causing that?
What happens is the kidney contracts the arteries, okay, in itself when things are going wrong, okay, deficiencies, and the pressure goes up. Well, once you get what it wants, it opens up and the pressure in the arteries comes down. No more high blood pressure. It's very simple. I mean, you can have high blood pressure for 20 years, and in 2 weeks' time, we can get rid of it. I mean, it's just that simple. Okay, once you have to love your kidneys as you love your face. Okay, you really have to take care of your kidneys and they will be good to you for your entire life.
So that the vessels inside of them contract, meaning that they get tight and small, which then restricts flow, which
Blood pressure
boosts
goes
your
up.
blood pressure, because the blood pressure is trying to push the blood through it so that the kidneys can filter.
That's correct.
So what are some things that would negatively affect kidneys that are either in our environment or in our diet?
Well, bad foods, fried foods, because of all the inflammation caused by the oxidized oils when you fry foods. And then you're talking about too much sugar. You're talking about oils also create inflammation. Okay. And of course, deficiencies of many nutrients. There's many nutrients, and I always hate to elaborate on a specific nutrient for specific organs and things like that, because then people run to the grocery store and they buy that one nutrient and they get some, maybe a little benefit for a while, and then they die because
I used to do that, Dr. Wallach, and it never worked for me. And thankfully I did not die.
yeah. And so when they die, of course, game over. But they have this thing, well, I just want to take the one that's going to help me with my complaint. Now, you don't do that with your car. Okay, you don't put dirt from Texas in your car and, well, there's bound to be some oil in it. There's just dirt from Texas. No, you put high quality oil in your car. Okay, and you put high quality gasoline in your car. You put high quality brake fluid. You put high quality coolant. You put high quality stuff for your transmission. Okay, and you have to do the same thing for yourself. And this is what I learned. And I learned this because of my own personal issues. When I was 9 years old, they're going to put me in one of these high security hospitals. I called it a hospital prison. And because I was a very violent kid, they didn't have a name for what I had, but it was, I could beat up, at 9 years old, at 5 years old, I could beat up a 200-pound man. Okay. There's no problem, because I'm throwing bales of hay and stuff like that on the farm. And so I was very strong. And my parents had taken me to 20 different doctors. It was a combination of just simple medical doctors in a private practice, pediatricians, psychiatrists, pediatric psychiatrists, 20 of them over a 5-year period. Not one of them could help me in any way, shape, or form. Not one bit of help. And so I'm sitting on the end of my bed on Friday night, and my parents are packing my clothes because Monday we're going to this hospital prison, and a prison hospital, however you want to say it.
So it probably was more like a mental institute, because you were such an aggressive, uncontrollable.
It was a high security. It was very high security with armed guards. Okay, because if we were coming after somebody, one of the doctors, they just wanted to shoot you. Okay, get it over with. Okay, this was a very high security facility. And so I'm sitting on the end of my bed and saying, okay, why? It's nighttime. My parents are packing my clothes so we could leave on Monday to go to this facility. Then why am I having this struggle? I'm not really a bad guy. Well, what's going on here? And then I started thinking, the animals on our farm, they're drinking the same water I am. They're eating the same grain, the corn out of the gardens I am, and they don't have my problems. And so Saturday morning, I threw my oatmeal, which causes you to not be able to absorb nutrition because it has gluten in it. I didn't know that. Nobody knew that back then. And so I said, okay. And I threw my oatmeal and my Cheerios, my Wheaties out to the chickens. I went to the barn. I got the alfalfa pellets that we feed the calves to, but it wasn't for the alfalfa pellets. It was for all the vitamins and minerals that we had put in there. Okay. We had the manufacturing companies put these vitamins and minerals in the alfalfa pellets. And so Saturday morning, I put them in my cereal bowl, put milk in it, had them. Sunday morning, did the same thing. Monday morning, did the same thing. By 3 o'clock in the afternoon on Monday, I was cured. After 2.5 days of just taking all these vitamins and minerals, okay, and all the drugs and all the doctors and all their medical knowledge and stuff couldn't help me. And it was very, very dramatic, but I didn't say anything to anybody. And my parents kind of noticed it, obviously. And so they didn't take me to the hospital. They said, well, you're doing pretty good here. Let's just look at this for another week or two. Okay. And then after a month or so, people at school and at church are all noticing it and whispering and pointing. I mean, it was a totally different person. And after a while, after about 3 months, they're coming to me and say, I have diabetes. Can you help me? I say, oh my gosh, I'm only 9 years old, but I don't know anything about diabetes. And so I had to look it up. I looked it up in the animal books that we had on the farm and how, what vitamins and minerals they gave for animals with all these problems. And I started recommending them for people, and I'm curing them. I'm only 9 years old. I'm curing them of high blood pressure, diabetes, arthritis, that kind of stuff. And what should I say, getting people off of dialysis and all this kind of stuff. So I really said, okay, I need to really get on the academic piece of this. And that's when I graduated high school, went to the University of Missouri School of Agriculture. That's where I started.
All right. Well, let's get back to kidneys. And then something that you just mentioned, I had just pulled up an email, and this person that wrote this email popped in and raised her hand. That has to do with how fast these supplements work. So real quick, Heather, if you can give me a yes, up and down, side to side, can you share what you wrote with? And please go ahead and unmute yourself.
Can you hear me?
Yes.
Yes.
Okay. So I got the tangerine tablets, and the first that I took them, which was yesterday, me and my husband both took them, and our urine looked radioactive. And I looked it up, and it said something about maybe if you didn't need as much as vitamins of some kind, maybe, then you would just pee it out. And but today, I mean, I feel like a new person. And my husband told me this morning, he said, everything has the awfulest placebo effect on you there ever was. And I was like, well, maybe it is, but maybe it's the vitamins. I said, I guess we'll never know. I said, but either way, I feel like a new person.
Very, very good.
And that's just what, 2 days?
Yeah. And it's just the tangerine tablets.
Did you have a diagnosis of all your health problems?
No, I mean, I'm 31 years old and pretty healthy, but I don't know.
I felt miserable.
Yeah, I mean, I'm healthy, but didn't want to get up out of bed every morning and do anything, and I can't remember nothing. And
are you from Texas?
Can't focus on anything. Huh?
Are you from Texas?
Eastern Kentucky.
Okay.
I was going to say that's for Kentucky, Doc.
Yeah. But he asked me the other day, he said, I wonder why dogs don't get fat and they don't want to lay around and be lazy all the time. I said, I just watched an episode on Beyond Belief the other night. I think it just answered that question. And it was that episode where you was on there and talking about, how they have all the vitamins and minerals in dog food, but not baby formula. I said, I think the reason.
I had to sue the FDA in federal court 8 times, and I won all 8 times, to force the manufacturers of baby formulas, Enfamil, Similac, and the like, to put the vitamins and minerals in there. And of course, we got rid of cystic fibrosis, supposed to be a terrible birth defect. We got rid of muscular dystrophy, and I'm just so proud that Jerry Lewis knew about that before he died. They put a gag order on him so he couldn't say anything to the public or the newspapers. They got rid of muscular dystrophy, got rid of sudden death syndrome. And sudden death syndrome, doctors were saying that mothers were laying on their babies and suffocating them, which is very simple sudden heart death caused by nutritional deficiency, the same thing that causes sudden heart death in young athletes. It's just when it happened when they were 6 months old or 3 months old, they were blaming it on the mothers laying on them, which wasn't true. But the doctors couldn't find anything. They didn't know what to look for. And their pathologists didn't know what to look for. And so they weren't finding anything. And I'm the one, when I started looking, we went, Dr. Milan and I, we went to China, to Qishan University in Heilongjiang province. We did 1,700 autopsies on kids under the age of 10. And the ones under 1 year of age would have been diagnosed with sudden death syndrome in America. It was published in 3 languages, Mandarin, Cantonese, and English. So nobody can say I didn't do it. Okay.
Dr. Wallach, I have a question, and this is relation to kidneys. And
Mhm.
she had just mentioned, because the kidneys are filter, that's why I'm asking this question.
That's correct.
She had just mentioned how the urine was discolored.
Mhm.
When you take a quality supplementation, it could, in the beginning, discolor your urine. What would be the cause of that? Is that because I know
having your urine be clear, just like clear water out of the tap, and then your urine turns yellow or orange. Well, there's all kinds of nutrients that cause those color changes. Okay, beta carotene, pre-vitamin A, vitamin C can cause coloration of the urine. And so that's not a bad thing, but it just tells you that you're not getting the maximum of any things you're taking because, you're urinating some of it out. And so we have a program for this, of course. We have the 90 essential nutrients. It's our basic program. And then what we have is what's called the Ultimate Daily Classic Tablets. There's 3 words, Ultimate Daily Classic Tablets. They'll support healthy blood pressure because it increases blood flow everywhere, including the brain and the heart and the liver and the kidneys. And let's see here. The dialysis was the answer that the medical system came up with, where they put you on this machine, and the machine takes the place of your kidney, cleaning the dirty stuff out of your blood and making an artificial urine. Okay, that process is called dialysis. And I get hundreds of people off of dialysis every week all over the world. We take people who are on dialysis for 10 years, 6 days a week, hadn't urinated in 10 years. And, in 3 days' time, they're urinating. Okay.
so you're saying that basically the change of color of urine is not a bad thing, but
Well,
it could show that you're not getting as much absorption as you potentially could.
yeah, it's not a fatal thing. Okay, but it is something. It says kind of like a barometer or thermometer is telling you that there's something not 100%.
Okay. All right, thank you. So Heather, if you have an additional question, go ahead and stay with your hand up and I will get back with you, okay?
Okay, my kids are getting off the bus, so I'll just have to check back in tomorrow though.
Oh, well, we'll try to make it really quick. So, no, let's go ahead and do it. Take it right now. Go ahead, Heather. What is your question for Dr. Wallach?
The vitamins, just says the ones that I started taking, is that like all the 90 essential nutrients?
I'll apologize. I don't know which one you're taking. Are you taking?
So she has the Beyond Tangy Tangerine tablets. So that's a good portion of them, but that's not the full 90.
No.
So
It's not all of them, no. It's just part.
Yes. So
Dr. Wallach,
what she needs is, if finances are an issue, she needs the healthy, let's see.
Body
here.
Start Pack.
Yeah, the Healthy Start Pack. Okay, that'll give you the 90, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. If finances are not a problem, I'd go with the Healthy Brain and Heart Pack. That'll give you 215 nutrients, and you still have that core 90 in there. Okay, and then of course, you got to remember to take the let's see here, the Ultimate Daily Classic tablets. Take 3 of those twice a day. If you're on high blood pressure medication, don't cold turkey off your medication. But as the blood pressure begins to come down, you can slowly reduce medication based on the numbers. Okay.
Okay, well, I'll check back in tomorrow and watch your all's video.
Who's that?
Thank you for answering the question, though.
You bet.
Yeah, so Heather, real quick, you had mentioned that you've got brain fog, kind of sluggish. What's in the Brain and Heart Pack is specifically designed to give the body what it needs so that you don't have to experience that each and every day. So if you can go with the Brain and Heart Pack, you're getting those additional essential fatty acids, which are a big part of supporting the brain and its function, and the heart and the kidneys and the lungs and the skin and hormone development. I mean, it's just, everything's connected.
Yeah, and if finances are not the problem, I would also throw in the I-26, which is very, very good for the white matter of the brain, the myelin, which makes up 25% of your brain weight and spinal cord weight. Okay. And so you want to take 3 servings a day. It comes in powder in a canister like this. It comes in sticks.
No, just 1 serving a day of that, Doc, is plenty.
One serving, okay. And it
You
also-
take,
also
yeah,
comes-
you take the chewables, which are 3 per day for 1 serving. So
Yeah.
1 serving, and that helps the digestive system also, including that brain gut connection.
Yep.
Okay.
So,
Well, I'll get on there and I'll order some in the next little bit.
Okay.
All right.
all
Thank
right.
you.
Thanks for joining us today, Heather.
All right. Bye.
Bye-bye.
Bye-bye. All right. Well, Dr. Wallach, I'm glad we were able to fit in kind of like a little testimony of how fast she's feeling the results and then helping her with the full 90 essential nutrients, plus what's needed to help with some of the things that she had going on. And folks, that's it. You get the foundation. Once you have the foundation, if you've got other things going on, then we build on that. But you have to have that solid foundation to keep things from continuing to go backwards. Because it's those nutrient deficiencies that Dr. Wallach found to be associated with over 600 different poor health conditions. So it's you've made it simple, Dr. Wallach.
Well, we try, and of course that's why we have so many books. And which I say is people learn that these books are available and they can buy them for wholesale. Okay, they buy them for wholesale, and it's one of those things where the information in there is stuff they don't teach them in medical school. These things are not taught in medical school. All they're taught in medical school how to quickly relieve pain, which is not a bad thing, as long as you're doing it at the same time as you're repairing the tissues and the organs. Okay, but just to relieve the pain, and the people continuously get worse and worse and worse, and so they're increasing the amount of that drug, or maybe you're adding other drugs to it, and then they'll die in 6 months or a year, 2 or 3 years. Whereas if they were taking all 90 essential nutrients and staying away from the bad stuff, they could live another 25 years.
So when you're taking something to control the pain, and this was my story, there wasn't anything that was being recommended by the medical field at all to help support kidney function or liver function. But when you're taking those chemicals, Dr. Wallach, I've heard many different places that those chemicals will then settle because they're being filtered out. Is it the kidneys or the liver or both?
Both. The liver is one of the biggest filter systems in the body. Okay. The kidneys particularly filter blood, but the liver filters everything. Okay. And it's one of those things where the good nutrients are stored in the liver. The liver is a big storehouse, okay, for so many different nutrients. So when you get a lot of it, you're not going to pee it out. The liver says, "Give me," and the liver hangs on to it. So when you have a time of depletion, or a time of you're not getting any more deficiency, is slowly releasing what you need, because the body say, "Hey, liver, I need some calcium. Hey, liver, I need some of this. I need some of that." Okay, and so the good Lord put us together in a very, very interesting way. Is when you think about it, you're able to store things you need every day. So when you have excess, you store it. And so when you're depleted, you leave some seep out to where you can utilize it and meet your needs. I really think that's very cool.
I think that is very cool, and that works very well with nutrients, Dr. Wallach.
Yes.
But what about the chemical pharmaceuticals? I mean, one starts wearing off and you're instantly going for that bottle, wanting more because you're getting that pain coming back. And I'm only speaking from experience, not an experience I ever want to experience again. So I stay on the 90 essential nutrients plus. So it's not, yeah, plus. You've seen some of my pluses, Doc.
Yeah, you take almost as much as I take.
Yeah, almost. I stay away from those male hormone things though. Just not my cup of tea. But again, going back to the chemicals, I mean, it's storing there, and chemicals aren't feeding anything. In fact, they have been shown to cause damage, yet they keep prescribing them.
That is true. Mostly chemical pharmaceuticals have side effects, they're called. Okay, negative side effects. And some people, they get itching. Some people, they'll urinate 20 times a day. There's all kinds of side effects. I know I get the side effects, but I just couldn't stand the pain anymore. I couldn't stand this symptom anymore. So I'm willing to put up with that stuff, the side effect of the drug, so I get rid of the thing that I don't want. And so that's what people had to deal with. And that's not true. The body has a very unique way of storing things that aren't found uniformly around the world. Minerals are not found uniformly around the world. They're found in veins like gold and silver. And that's why there's some people like Hunza, where people live to be 120 as their life expectancy. And then you have people, places like Kenya in East Africa, where the life expectancy is 59. Okay, it's 120 more than 69, it's double. Or 59.
Yeah, it's definitely double, Dr. Wallach. Yeah. But as I look back on some of the things that I was on myself, and the side effects being cirrhosis of the liver and kidney failure, it's like, why did I not read those inserts that came with my pharmaceuticals then? And it's because folks were in so much pain. We just want relief. Well, it covers up the pain and it doesn't do anything to address the underlying causes. And that's what this program is all about. Bringing Dr. Wallach to you is huge. If you want any type of positive health journey, and your journey to getting old being more of not down in the dumps, not a bowl full of cherries with a bunch of pits. We're talking being able to enjoy life as you get older.
Let me throw two famous people in here, if I may. Pat Boone, okay, had terrible arthritis. I mean, really, really bad arthritis. It was getting worse and worse. The doctors wanted to do a double knee replacement on him. And we got him on our Healthy Bone and Joint Pack and got him on the MSM and that kind of stuff, and collagen peptides, vitamin D3. And we got rid of his arthritis. He never had to have any joint replacements and hip replacements and knee replacements, all that kind of stuff. And he wrote the foreword to this book here, The Wallach Revolution. And then Danny Glover had terrible, let's see here, he had
seizures, Dr. Wallach.
What?
He had seizures.
Yeah, he had seizures, and he had it's
called epilepsy, but seizures being a side effect.
Epilepsy, yeah, epilepsy. Yeah. Good. Epilepsy, okay. He had those things, and he had it from a kid, and it was getting worse and worse and worse, and he just couldn't perform in his movies and songs anymore. And we got rid of that for him, and he wrote the last chapter in this book, The Wallach Revolution, Danny Glover. And of course, we have the story of people like Theo Ratliff, great basketball player, rebuilt him. It's a big story, so we'll do that. We'll do that another time. But we rebuilt him. He's in this book. That's a big story there. And a lot of politicians and famous people and so forth, including let's see here. We already said that. See here, Jerry Lewis. He didn't have a problem, but he was a guy, Jerry's kids for muscular dystrophy. We were able to find the cause, prevention, cure for muscular dystrophy. And he was so excited. He took it to the Muscular Dystrophy Association in September of 2011. So I think it was September 4th, 2011. They fired him, put a gag order on him so he couldn't tell the stories to the newspapers and TV and radio and stuff. And the next day on the 5th, they shut down the telethon. The telethon had earned the Muscular Dystrophy Association $2.6 billion over 46 years. They shut it all down and fired Jerry Lewis, put a gag order on him. He died a couple of years later, but he knew that all his work had not been in vain, because he and I together, we found the cause, prevention, and cure for muscular dystrophy. And he was just so happy that he learned that before he died.
Well, and that's what this program is all about, Dr. Wallach, is to get that story and other stories out that give people hope. Yes, the Wallach Revolution, you can get the Wallach Revolution. It's only been out for a month, about just over a month now. You can go to drjwallach.com and order your copy today. That's drjwallach.com. Look for Wallach Revolution. Dr. Wallach, let's help some more people, because we have
Okay.
some hands up and we have some questions out here in YouTube land and Facebook and Rumble. So let's go ahead and get to them before we run out of time.
Okay.
First hand that we have going up right now, or the next one actually, is Carrie. Carrie, I know you were on video just a few moments ago. Are you still available?
Yeah.
Awesome.
Can you hear me?
So we can. So naturopath to naturopath, Dr. Wallach. She has some questions in regards to a client and needs your guidance, please.
Yes, I have a woman who was in a car wreck in March, and she got a concussion, and she has some serious lingering symptoms that she's going to go to a neurologist this week for. So she's 57, she's 5'3", weighs 155. The accident was March 9th. She has had and has always had tinnitus, but she doesn't have any limb pain radiating down. It's mostly head and neck pain, but she's very nauseated and has dizziness and
Okay, stop
headache.
there. Stop right
Okay.
there. Did you ask her how many times at night she wakes up to urinate? Once, 3 times, 5 times, 10 times?
I did not ask her that.
That should be a
but-
question you ask everybody, okay?
Okay.
Well, she's got osteoporosis of the skull. That's the tinnitus. It's a squeezing of the auditory branch of the eighth cranial nerve by the skull.
Yeah.
And she has this dizziness, okay, a balance issue. All right.
Right.
All of this is found, the osteoporosis of the skull is found in this book. Okay. All right. And the top skull is normal. This is an autopsy. You cut the top of the skull off, looking down on the brain. Can you see it okay?
Yeah.
Okay. And you see that the skull is only a quarter of an inch thick. The bottom one is an autopsy. We cut the top of the skull off. We're looking down on the brain. You can see that the skull is 1.5 inches to 2 inches thick because it has osteoporosis. That's not bone. That's actually just scar tissue because they have osteoporosis. And it's squeezing the 12 pairs of cranial nerves and squeezing the spinal cord. There's 37 different diseases you can get. You know, you can get 2 or 3 of them or 5 of them or all of them. Okay. And doctors know nothing about osteoporosis of the skull. So this book and CD set, okay, 3 authors, myself, Dr. Milan, and Rebecca here. Rebecca and I did the CD that goes along with it. And it's one of those things where it makes you breathless. The doctors know nothing about this. They'll
Right.
send you to their classmates so that they can get, you know, they'll treat you symptomatically and you get
Right.
some relief of the symptoms, but you really don't get down to the basic root cause, which is osteoporosis of the skull, which is a very simple nutritional deficiency. And doctors knew nothing about this. Being a pathologist, I would see this at the autopsy table. You know, they're dealing in the knees, and the stuff was going on in the brain. It was dealing they're dealing in the kidneys, okay, because they're urinating 5 times a night, and it's all in the brain, okay, being squeezed, okay, the spinal cord being squeezed. And so it's one of those things where, okay, this can't go on this way because insurance companies are just milking people for doctors treating the wrong disease. Okay. And so that's why we came out with the book and the CD, and it's a big seller. It's written in the 6th grade reading level, so you don't have to be, you know, have three PhDs to understand what's in there. And
Right.
it's very well documented. There's a lot of references in the back if you want to go look at some original research and that kind of stuff. But
I read the e-version on a vacation, but I need to buy the hardback so that I can make notes.
okay,
Yeah, but she says she does get up to go to the bathroom. I'm texting her. She's not saying how many times, but recovery from the, I mean, she says right now that all she wants to do is sleep and go hide in a dark, quiet room. You know, she's become very noise sensitive and nauseated, and it's been going on since March. So is there anything extra that we should do because of the concussion?
She needs, how much does she weigh?
145.
145. Okay. Well, she needs to get rid of all the bad food. She needs 2 health brain and heart packs per month, full dose of everything twice a day. She needs 2 bottles a month of the MSM. She can take 3 at breakfast, 3 at lunch, 3 at dinner time. That's going to rebuild her connective tissue, her cartilage and ligaments and tendons and her bone matrix and all that kind of stuff, right? Then she needs the collagen peptides. It's cool with other morning drinks or other evening drink. I want her to have a rebound so she gets energy from 100 nutrients in the rebound. I prefer the sticks and the powder. The canisters or the cans, if you're going to drink the cans, you got to pop the tops on them the night before you're going to drink them, because I want to get rid of the bubbly. And then I also want her to take the Ultimate Daily Classic tablets. Okay. 3 of those twice a day. That's 2 bottles a month, and that'll get the blood pressure down. If she's on blood pressure medication, she cannot cold turkey off the medication, but as the blood pressure drops, she can slowly reduce the medication based on the numbers. Okay. All of those things are totally reversible very quickly, because we know that they're caused by osteoporosis of the skull.
Right. Okay. So do you think, did the concussion just aggravate the osteoporosis of the skull? Did it just aggravate?
If you have osteoporosis of the legs, you get whacked in the legs, it's going to hurt more.
Okay.
Same thing with the skull. If you have osteoporosis, you don't have osteoporosis of one bone.
Right.
I have osteoporosis in my trigger finger. No, you got osteoporosis every bone in your body. Okay, you just have more awareness of your trigger finger because you're typing or punching something on a machine or something like that. Okay, but you don't get osteoporosis in just one bone or one region. When you get osteoporosis, every bone and every joint in your body is suffering.
Right. Okay. So then this just aggravated what was already there.
That's correct.
Okay.
Because I'm sure she has those complaints, about waking up at night 3 times, 5 times a year night kind of thing. She had this pain, that pain. And when she got whacked, in this car wreck, that made the awareness worse.
Emphasized. Okay.
Yes.
Yeah. Okay. All right.
Keep us up to date. Call us every couple of weeks. Let us know her progress. Okay.
I will. Okay. Thank you so much.
Thank you.
All right. Thank you, Dr. Carey. Dr. Wallach, I have a question that came in last week in regards to a 49-year-old female. She's 165 pounds. She has had narcolepsy since she was 11, epilepsy since she was 13, a brain tumor surgery in 2015, and the scar tissue is still causing seizures. No, she does not wake up multiple times to go to the bathroom at night. So, and she said all of her issues are in her head. So Dr. Wallach, what would you recommend? Because she doesn't have arthritis or any type of joint and bone issues. She is on medications.
I'm sorry?
She's on medications. She really struggles with sleep and depression. They keep adjusting her meds, and she binge eats.
Okay, well, when you binge eat, that means you're missing something, okay? Your body's telling you to eat. That's called pica, P-I-C-A. Look it up. It's you can find it in any dictionary, P-I-C-A. And that's why people gain weight. That's why there's 1,200-pound humans. Humans can get up to 1,200, 1,500 pounds when they're eating 15 meals a day. What are you doing eating so many meals? I don't know. My body's just telling me I'm hungry. I'm eating. Okay, that's because they're missing nutrients. And so this is where a hair analysis will be very useful. Okay, so to show them, okay, what's going on here. But I guarantee you, there's more going on than any doctor would pick out from a standard medical examination. So get a hair analysis and get that book, Rare Earths Bin Cures. Rare Earths Bin Cures. Amazon just bought 100 of those this morning. Okay. Rare
It's
Earths Bin
109. I thought
109.
that was pretty awesome.
Yeah. Okay. And so she needs to get one of those books, Rare Earths Bin Cures. Go to chapters 10 and 11. It starts at page 272. It tells you how to collect the hair, how to package it, where to ship it. Don't forget to put in the check. If you're in a foreign country, you had to use a money order. Any state in the United States, you can use your personal check. And let's see here. In the meantime, while we're waiting for all that, be sure that you're getting that sample in so we know what's going on. Do you have toxic metals? There'll be several charts in there. The two charts that I like, one is the essential nutrients. It tells you how much of each one's in there in your hair. Okay. And then the second one I like is the toxic metals. It tells you how much lead and mercury and uranium and stuff like that you have. And we know how to get rid of all that also. Okay. But this is, we have so many people who go through this and they come out the other end just really feeling 25 years younger and getting rid of all their symptoms and this, that, and the other, because it's all due to either malnutrition or toxicity in the brain. And this is all resolvable, but you have to know what you're treating. You can't just guess. You have to know what you're treating.
Absolutely. So Dr. Wallach, let's try to get through at least 3 more hands here in the next 10 minutes.
Okay.
Lauren, go ahead and unmute yourself.
Hi, everyone. Let me get my camera on. I'm Lauren. I'm a new follower. I heard you on NPR, and yeah, I'm really having a tough time losing weight. I started birth control a couple months ago, and it seems just like the weight keeps growing. I'm looking into some of the supplements, and I take, collagen on my own, but
Okay. How much do you weigh now?
I'm 155.
How tall are you?
5'2".
Okay, so 110 would be about right for you, 110, 115 kind of thing.
Yeah.
Okay. And so, yeah. Any other issues, any diabetes, high blood pressure, any joint pain?
No, I'm 35, so I'm starting to feel my knees go.
Okay.
Wake up to go to the bathroom probably twice a night now.
Okay. And what about, let's see here, diabetes, high blood pressure?
No.
Okay. Very good. Yeah, you have osteoporosis of the skull. Not unusual. Babies are born with osteoporosis of the skull. It's not an age thing. Okay. Babies are born with it. They get what's called Erb's palsy. They're paralyzed from the neck down when they're born, when they have osteoporosis of the skull, squeezing the spinal cord. Okay. And doctors just think, oh, that's some genetic disease. No, that's the mother was deficient in these nutrients and passed the deficiencies onto the embryo. Okay, well, here we go. At 155 pounds, I want you to get rid of all the bad foods. Okay, get my book, Dr. Wallach's Cooking Without the Bad Foods. Goes into 300 pages of safe recipes, safe cooking, all that kind of stuff. And it has a list of the good food, bad food list, very important. Then you need to get 2 doses a day of the Healthy Brain and Heart Pack. Take a full dose of everything twice a day. Get 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, or dinner time. They're going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, discs between vertebrae, bone makes myself, including the knees and the hips and the shoulders and back and skull and so forth. And then for the weight loss, I want you to replace 1 meal a day with what we call our keto shake, KETO shake. Now, Rebecca, you can talk about it for a minute or 2 on the keto shake. Can you lose weight with the keto shake for 1 meal a day?
Using the keto shake by itself, no, but when you put the 90 essential nutrients in there, absolutely. The 90 essential nutrients it's the body that's missing and starving, so it holds on to everything. So you get on the full program and then add that keto shake, which is full of nutrition, but without all the calories. So the body can focus on using the nutrition instead of using its energy to burn the calories. It makes it much easier.
Okay, and so I think that's where we would go. And wouldn't hurt to get a hold of that book. It's all in your head, the book in the CD set. It's a set, and you'll understand what's going on. Okay, there you go. It's all in your head, and that causes the urination problem at night because the skull is squeezing the spinal cord, and the spinal cord is telling your urinary bladder to urinate. And that's why people say, well, why am I getting up 3 times a night to take a pee? Well, that's because your skull is squeezing the spinal cord, and the spinal cord is telling your urinary bladder to urinate. Now, it can't be the prostate because this happens more frequently in women than it does in men, and women don't have a prostate gland. The last time I looked, okay?
All right. Thank you so much, Dr. Wallach. And Lauren, if you have any questions, feel free to get with your coach. If you don't have a coach that you're working with, then we can answer questions at dailywithdoc.com. Use that, contact us. And just as a note for everybody, if you were shared this program by somebody specific, make sure that you get back with them. They took the time and they cared enough to share this program with you because they wanted you to get information that is empowering to help you on your health journey. So get back with them. If there is nobody to thank, then feel free to go to our website, dailywithdoc.com. Use that, contact us, and one of our certified holistic health coaches will get back to you. We also have a call team, 855-949-3377. This is for those who are not working with a health coach, who have never purchased any longevity products and are looking to make changes in their life and be focused and directed towards what's going to be the most beneficial to them. Dr. Wallach, we have an important one coming up. They're all important, but Marlene, go ahead and unmute yourself. Thank you so much for raising your hand. She has a question, Dr. Wallach.
Hi, Doc and Becca. Thank you for this opportunity to speak with the doc.
Okay,
My husband was recently diagnosed with gastric cancer. He's 154 pounds, 70 years old, obviously male, and he's a diabetic. So, this is relatively new to us, so we're just trying to figure out the best way to go about treating this nutritionally.
Okay, what did the doctors recommend? Did they say we're going to take your stomach out? Did they say we're going to give you chemotherapy? Do we know what
Yeah, the first thing they told us was, they'd have to remove the whole stomach, and we weren't really down with that idea. And then chemotherapy, which is supposed to start the week of the 21st.
Okay. All right, 154 pounds. Well, stomach cancer is problematic because that's where all your food, needs to come in.
Yeah.
Okay. And so one of the things they can start immediately is take our plant minerals, our liquid plant minerals, and rub half a teacup on his chest 3 times a day, and on his belly 3 times a day, on his back between his shoulder blades and his lower back 3 times a day on each of those. So he's gonna go through maybe 3 quarts a month of the liquid plant minerals.
Okay.
And we have seen miraculous results because this supports the immune system. It's absorbed through the skin, almost like intravenous.
Okay.
It's crazy how fast it absorbs through the skin. Okay, got to lay down so it doesn't all roll off into the wrong area. Okay, you can't stand up and put it on your chest; it'll just roll down to your toes. Okay, you got to lay down, right? Okay?
Yeah, no problem.
Okay, and then 154 pounds. Also wanted to have 2 healthy brain and heart packs per month, a full dose of everything twice a day. If that's too much for the stomach, we do have the let's see here. You have the kids toddy, which is a liquid. Okay, it's kind of like a baby formula. Okay, and so this person 154 pounds, it'll give you on the back of the bottle how much to take per pounds of body weight kind of thing. And then also he's gonna need to take the EFAs to prevent blood clots and that kind of stuff, because we didn't put any EFAs in there, but it has a lot of stuff. And of course, those liquid plant minerals on the skin of the chest and the belly, the upper back, the lower back, 3 times a day. And we're talking about a half a teacup at each location 3 times a day.
Okay.
Okay. But again, when you put it on there, if they're laying down, it won't roll away. It just goes right in the skin, like in a minute. It just absorbs right through the skin. It's like intravenous. Okay. We've seen miracles happen with that one. Okay. And let's start there. And of
Okay.
course, let's start there. Let's see here. Oh, we also have the Rebound or sports drink. That has 100 nutrients in it. You could have
What was that?
Rebound.
Rebound.
Rebound, okay.
Okay. Sorry about that.
Yeah. So Dr. Wallach, anything else? Did you get the Z radical and the oxybody in there? Because I know you have to get going.
Yep. I think that's where I would start because of the stomach issue.
Okay.
And
All
the
right, well,
Yeah.
we'll
And-
get started with that. And we'll get back to you with how it goes.
And the kids toddy, don't forget the kids toddy.
Got that. Got the kids toddy, the EFA, the Rebound, and the plant minerals.
That's correct. Let's start there.
Okay, thank you.
And if I could add, and I know Dr. Wallach, you need to get going, but thank you so much for joining us here today. We appreciate you. And if I could add to that, Marlene, just a note on the Rebound, because you want to stay clear of sugar when we're dealing with certain conditions
Okay.
that feed or be fed by sugar. The canister of the Rebound has the least amount of sugar. So
Okay.
we want to make sure that we do that and then spread it out, not like full doses all at once.
Okay.
If he needs that. Okay.
All right. Thank you so much, Becca. Thank you, Doc.
All right. Thank you, Marlene. We appreciate you coming on and glad that we were able to get to you. Raise your hand earlier next time. I know you were on an hour early,
I
so
know.
wanted to make sure we got to you.
I'm on
But
the East
thank
Coast.
you. Yes, yes. Love those time changes.
Yeah.
If I could get my co-hosts on with me, I could not do this without them. They are absolutely vital and essential when it comes to making a program work because folks, we're not in this by ourselves. We're in this as a team. We all work together as a community, and we have a lot of coaches who are on with us, who are part of that community. And I know we have guests that have been invited by those coaches. Get back with your coach. As a community, we do great things. And if you are looking for a community to be part of, you are health-minded, or you want to be health-minded, we have a lot of amazing resources to help you do that, including the Institute of Holistic Health that was co-founded by two of Longevity's top leaders and Dr. Wallach. They put together a certified holistic health coach program that I'm very proud to be a part of as a student services director. And each of the people that I have working with me, almost everyone that is part of our team, our call team, our community, they are so eager to jump in and be part of this certified holistic health coach course. And the information that they learn from it, we have doctors like Carrie, who was just on with us, who just loved the course. I have doctors like Dr. Debbie, who have gone through the course. She's a retired oncology surgeon, folks, and she's just amazed at the information that she learned through this program that she has now been able to implement in her private practice through alternative medicine. We've got myself. I'm not a doctor. Yes, I was an herbalist, did a lot with herbs and tried to do nutrition, but I couldn't fix myself till I found longevity. And that's what gave me my life back. And I know each of my co-hosts have a similar story. Give us 90 days. Learn about what you yourself can do as an individual when it comes to the body. There's 4 main areas of health, folks. If you've got deficiencies, all 4 areas are affected. And that's what this coaching course offers and teaches. And then gives us solutions. It's not just tell you everything that's wrong, but we go into solutions as well. So get back with the person that shared this program with you. Ask them if they know anything about the health coach program. If they don't, you can go to Coach with Becca, and I have information about the program there. This program is just touching lives around the world. I know we didn't get to all the hands that were up or all the questions out on YouTube. Please, please, please go to dailywithdoc.com, use that contact us, and send us your questions. I am going through the ones that we already have Dr. Wallach's protocols for. We're getting those protocols to those that have answered. The requests have been great. It's just overwhelming how many people are finally looking for alternative options because what they're doing is no longer working. My name's Becca Dukes, the hostess of this program. I have on with me Ruth Ellen Sanchez. He does a lot of my technical stuff for me to make sure everything is loading, and so I don't have to stress about that. She gets to stress over that, so thank you, sister. We have Sherry Browning, who is going through and letting people in and watching cameras and watching the chat. We have Marilyn, who's doing just an absolutely fabulous job as Dr. Wallach is giving these recommendations. She is then transcribing them and putting them into the chat. So if you're here live with us, I hope you had that chat on, because then you would have been able to see that information. If you are out on our streams, we invite you to come join us sometime in our live Zoom. dailywithdoc.zoom.com is the easiest way to get there, but also go to our website, dailywithdoc.com, and subscribe to our newsletter. We have an amazing newsletter that we're putting together, but right now, each week we are sending you links to the previous week's programming. It also sends you the direct information on how to get on with us here on Daily with Doc. So there's a lot of things that you can do on your own to help yourself. You don't have to have somebody to tell you what it is or a white piece of paper to take to a pharmacy, folks. Nutrition, your body's starving for it. It's not starving for pharmaceuticals. Until next time, bye for now.